They hope they have the prescription to lower our prescription drug costs. It is called the New York RX Card, and we are joined by Francesco Ciccone with New York RX Card, or the website is NewYorkRxCard.com. Thanks very much for joining us.
Thank you.
What does the New York RX Card do?
It's a free statewide prescription discount card. Anyone, regardless of their age, their income, their current health condition, can download the card from the website, take it to their favorite pharmacy with their prescription, and get a discount at the point of sale. The discounts can be as high as 75% on generics, as high as 50% on name brands, with an average discount of about 31, 32%.
All right, and you say it's free. If I want it, I get it for free.
That's it. Correct.
And any age can participate?
Any age.
Is this a New York State program?
No, the program is not funded with 1 cent of taxpayer dollars. It's a free program. It's a private entity.
Okay. But you say users can find savings as high as 75%. How are you doing it?
We've negotiated with more than 64,000 pharmacies across the country to honor our program. The program is run through an organization called ReStat, which is a PBM, a pharmaceutical benefit management company. That's the way it's done. It's that simple. You just simply take the card to a pharmacy and you get a discount at the point of sale.
So are they counting on volume?
Of course they're counting on volume.
Enter into this agreement to give?
Of course, yeah. We've partnered with all these pharmacies, especially the chain pharmacies, and we direct as much business as we can to those stores. By sending more people, more foot traffic. If you get a savings on a prescription of $30 or $40, whatever it might be, you're more than likely to turn around and spend a portion of those savings on items on their shelves.
Do I incur a cost if I use this card somewhere?
None.
All right. Do all insurance policies accept it?
The program is compatible with all insurance policies. Whether you have a high deductible or a health savings account, you can use it while in that deductible period. It will not lower your copay. However, on every single type of insurance plan, you have what's called non-covered medications. Our card can be used to cover and discount those non-covered prescription medications.
Now, do I just show the card, or is this like an HSA where I have to provide funds for it?
No. You just simply show the card once. As long as you're using the same pharmacy, if you use it once, it'll be in their system.
Like an AARP card?
Correct.
Just show it to them. I belong to this group. Okay, here's your discount.
That's your card. If you download it off the internet, of course, it's a piece of paper. And then you just show that to the pharmacist once, and then you're in the system. But going back to the insurance with Medicaid, Part D, you've got a donut hole. During that donut hole, our card will discount prescription medications not discounted. Medicaid does not cover certain level 3 prescriptions, if you will. Our card can be used during that period also to discount those medications.
So how does somebody sign up?
Simply go to the website, NewYorkRxCard.com. Right in the center of the page, there's Create Your Card. You can download a personalized card or a confidential card. Some people don't like putting their name out on the internet. Okay, we don't capture the information anyway, but you can print out a blank card, take it to your pharmacy, and share your name with them.
All right. And as surprised as we are to hear this sometimes, some people don't have computers. Is there another way to do it?
There is. You can go to any CVS pharmacy, mention the New York RX card, and they'll process the prescription through that. There are other chain pharmacies also that are starting to come on board with that preferred pharmacy status, if you will, where if you go in there, you mention you'd like your program to be run through the New York RX card, they'll process the prescription. But CVS is the preferred pharmacy for the program. And somebody can't compare drug costs, that sort of thing? Oh, the website is very helpful. We have a medication pricing icon. We also have a pharmacy locator. You've got to put your prescription in there accurately, get the milligrams and all that, but it'll let you know which pharmacy in your area has the lowest price on that prescription medication.
How long have you been doing this?
The program relaunched officially June of 2011. Since that time, we have saved New Yorkers close to $50 million. And we expect to do that alone this year.
Also offers other discounts?
Correct. There's discounts for eyeglasses, hearing aids, teeth whitening products, dental services, diabetic supplies, and I believe LASIK surgery as well.
Wow. So again, how can people obtain this card?
NewYorkRxCard.com is the easiest and quickest way to do it. If you do not have internet access, go to the library, they have internet there, or simply go to a CVS pharmacy, mention you'd like to have your prescription run through the New York RX card, and you'll get a discount at the point of sale.
And anybody can join.
Anybody.
Well, can you explain, because you're very close to the industry, and can you explain what's happened to the cost of prescription drugs, why they have skyrocketed so?
There's a number of different reasons for it. Research and development is one. You know, there's a lot of money that goes into the development of a prescription medication, and sometimes what they start out to do goes in a completely different direction. Viagra is a perfect example. That was a heart medication. Okay, that's one of the reasons. Secondly, the amount of prescription medications that have been prescribed in the past decade has skyrocketed. And, you know, again, there's so many things. For instance, you know, asylums, they're no longer around. Medications have helped that. There's a medication just about for anything. Dementia right now. You know, there's medications out there for that. There's medications for just about anything.
So that's the R&D. We have more medicines available to us. Generally, they cost a lot when you start them up, right?
Correct.
There's a lot of upfront costs.
Millions.
And then if they become widely distributed, the cost per unit drops significantly.
Correct. And after a certain period of time, they go from a brand to a generic, and a generic alternative is available.
How close are they? Because I can't tell you how many times I have heard this. Somebody saying, you know what, the brand worked for me, the generic they're giving me doesn't work for me.
I think it really depends on the type of medication, and it depends on the person. It could be a psychological thing. I know they're very close. You know, our program will discount both. That's a good thing about it. Yes,
yeah,
whether it's a brand or a generic. Generics have a discount, could be as high as 75%, brand as high as 50%, again with an average of about 30–31%.
But just like if you're paying full fare, I mean, your generic is going to be more affordable than your brand. Your brand is going to cost you more.
Yeah, and a pharmaceutical term is usual and customary, UNC pricing. You know, we recently found out with a dementia medication, some lady was $900 for a 3-month supply, and with our card she paid $45. Now that's a rarity. I mean, usually you don't get that large of a discount, but that happens. Another young lady in New York with lupus prescription, it was $1,500. With our card she paid $185. So sometimes there's some amazing savings. Normally though, you can expect to save about 30%.
How many states is your company working in?
We have a card in every single state, and one nice thing about our program is you can take the New York RX card and use it anywhere in the country, including Puerto Rico. So just because it has the name New York on it does not matter. Anywhere in the country.
Are there different advantages enjoyed in different states, however?
No. No. The discount, the New York RX card will give you the same discount as the California drug card in California. It does not matter.
Yeah. Okay, so one more time, because it sounds very inviting. How do people find out? How do people sign up? Who's eligible? Okay.
New
York
York
RX
RX
cost
card.
them?
NewYorkRxCard.com is the website. Everyone, anyone is eligible, regardless of your age, your income, your current health condition. If you have a relative visiting from another country, they can download a card and use the card. Okay. Again, discounts can be as high as 75% on generics, as high as 50% on name brands. It's comparable with all insurances, whether you have high deductible or health savings account. It will not lower your copay. However, you can use it to purchase medications not covered with your insurance. You can use it during the gap period for prescriptions not discounted with Part D. And you can use it for Medicare for prescriptions not covered. It's that simple.
You mentioned overseas. If I was in London and I needed a medicine?
No. If you have a visitor coming in from overseas.
I was just seeing how far out this envelope goes. Gotcha. But if my cousin comes from London, I can print out a card and they can use it here.
Sure.
Very interesting. Francesco Ciccone with NewYorkRxCard.com.
That's the website, yes.
All right. Thank you very much for joining us. Very interesting concept. Thank you for joining us on Forum 13 today. I'm Phil Bailey, and we'll see you next week.